Welcome to Navigating the Customer Experience. Want to improve your organization's customer service? Looking for insider tips to knock your customer socks off? Then you're in the right place. Here's your host, Yannick Grant.
Welcome back to part 2 of Navigating the Customer Experience episode with Peter C. Yesawich on integrating hospitality principles into healthcare. So let's jump right back in.
You know, on that point, one of the things that we looked at in writing the book in our survey of 1,200 adults is how they use online sources to help them think about healthcare, you know, and whether it's evaluating, you know, healthcare providers or self-diagnosis. You know, we all joke about Dr. Google, you know, that we, you know, something happens and we quickly want to do web search, whether it's with Google or WebMD or any of a number of you know, site-specific, provider-specific sites like Mayo Clinic and Cleveland Clinic and so forth, to get that kind of information. But that would be my answer. I mean, and by the way, that is extremely helpful, but also generally very difficult for people to interpret.
Mm-hmm.
You know, so it's essential that, I mean, if they should absolutely do their homework, but they should also consult with a medical professional to make sure they've interpreted it correctly. So it's a combination of those two, but that would be my answer. Really, it's Google would be certainly the go-to source.
Mm-hmm. You know, it's amazing you said that. Like we take it for granted, but when you think about how we used to do research prior to Google, you know, Encyclopedia Britannica, go to the library, you know, it takes you so long to kind of get information. And I always tell my daughter, and even my mom, I tell her, there's nothing that you can type into Google that I am sure someone else in the world has not asked that same exact question.
Sure.
No matter how stupid you think it is, somebody in the world has asked the question and there's an answer there for you, you know? So it really is a knowledge base.
You know, what's interesting about that, though, is, you know, in hospitality, online, people go online to look at reviews. Right. So you look at reviews of restaurants or hotels or destinations or what it may be. And there are companies that have really built incredible databases like TripAdvisor and Expedia and so forth. And then you think about, well, why doesn't that exist in healthcare? Right. So if you wanted to learn a little bit more about, let's say, a particular hospital where you might be thinking about scheduling some kind of elective procedure or a specific clinician, a doctor, or a practice. One of the things you discover very quickly is it's very difficult to get that kind of information online about healthcare providers. And people ask why, and I'll share with your listeners, it's kind of interesting that came out of our research. There are two reasons for that. Number one, most of these healthcare rating sites will not publish any ratings on providers unless they have a minimum number of what they consider to be objective ratings, you know, and typically that's 30. So for example, if you go into health grades or any of the doctor sites, you'll notice a lot of the physicians, you know, don't have any rating. Or if they do have a rating, it might be a 1 or 2 ratings, and obviously people are generally very, very suspect about that if they don't have a broader base of patient reviews. Now, the question is, why is that? And here's the interesting part of the answer. We discovered that most of us are very reluctant to criticize medical professionals. You know, for example, the example you just gave about the pediatrician. Now, you're quick to maybe share that story with other friends, but my suspicion is you probably didn't go online, right, and write a review. Now, maybe you did, but my suspicion, did you or no?
I did not, but I don't think it's because I was reluctant to share it online. I think at the time, that would have been like 2006. I don't think it was that popular at the time.
It wasn't that easy.
Yeah.
Okay. Well, for most people today, they're reluctant to do that online publicly. And that's, we think that there's a really good psychological reason for that. And that is that we are all raised correctly, by the way, to respect the amount of training and the motivation of medical professionals. You know, that even if we find that, you know, their style to be a little abrupt and so forth, the fact of the matter is we absolutely respect their expertise. And the other aspect of that is we don't have the same vocabulary, right? So it's very difficult for us to interpret many times their comments or their assessment of our medical problem. So it's just not possible for us to rate them because we don't know. We don't know if it's good or bad advice. And as a result of that, what happens, these ratings are few and far between. Anyway, to your point, as we like to say, if you have an anniversary dinner in a restaurant where the restaurant blew it, well, you may go home that night and the internet will be blazing in terms of your negative response. But if you had a bad experience at your physician's office, you just kind of shrug your shoulders and kind of move on. But more and more, to your point, people are exercising choice and saying, I'm not going back to that office, or I'm not going back to that hospital. The experience was really bad. And generally, most insurance programs provide some options for you to use other providers.
Right. All right. Awesome. Can you also share with our listeners maybe one or two books that you have read? It could be a book that you read a very long time ago, or even one that you've read recently, but it had a great impact on you.
Yeah, I think I'll give you just one, and it's a book that I think resides in the same space as our book, our most recent book. It's called Compassionomics, and it was authored by two medical doctors from the University of Pittsburgh. And it's a fascinating examination of an idea similar to ours about hospitality and healthcare. And the book really addresses the critical question that most people in healthcare ask, and they say, well, we believe, we get the idea that compassion is important for patients as part of the customer experience and so forth, but it doesn't make financial sense, right? So that's the point of view, and that is, let me give you the best example. Most physicians today are under tremendous time pressure to see as many patients as quickly as possible. And that's a recurring theme of dissatisfaction for people in healthcare, where they say, well, I only saw the doctor for 10 minutes, and half the time he or she was looking at a computer screen. They weren't even looking at me. And well, the problem is that many of these practices, literally, they have performance criteria that says you should not spend more than 15 or 20 minutes with a patient, and you need to move on because the volume needs to be, anyway. So the whole idea of being compassionate, and a big part of that is just listening, and that is listening until the patient has expressed everything he or she would like to express, and also making sure they understand, what the clinician has concluded and is recommending. That takes time.
Yeah.
And it's a big issue of this of demonstrating compassion. And I tell you, I lived through that because I was, as I say, 10 years in the cancer care business, and you talk about the importance of compassion in medical facilities. I mean, there's nothing more challenging and potentially difficult than fighting cancer. It's the worst disease that anyone can be diagnosed with, and it happens to be the most expensive disease, and therefore compassion is essential, in terms of getting people through the process. But anyway, that's a long answer to a great question. But I would recommend that to anybody who is interested in the healthcare customer experience, because as it turns out, they make a very compelling case that says compassion and the delivery of compassion, the demonstration of that makes great financial sense for a whole bunch of reasons, and they build the case for that.
I can just imagine, because I mean, as I said to you at the beginning, the average person that goes to their doctor or hospital or clinic, I mean, they're in pain. So, when I do trainings for those persons in that type of industry, I genuinely say to them that, listen, if you don't genuinely care about other human beings and you're not genuinely there to help them, it's true, you're just in the profession for the financial gain. This is just not the area for you to be in, because, as you mentioned, compassion is one of those key skills that you need. And sadly, a lot of patients and their relatives, they don't get that. I mean, even COVID side, I heard so many cases where I guess they got immune to the fact that people were dying from COVID. You were just another dead person to them. And that person was somebody's dad, was somebody's mom, was somebody's sister, was somebody's child.
Right, exactly right. Yeah. It's funny because when we talk to medical professionals about our book, Some of them say, well, all this is wonderful, but healthcare is what they call a need service, and
Wow.
hospitality is a want service. And we stop them and we say, wait a minute, think about what you just said. Um, the point we make is that yes, many people pursue healthcare out of need. They're ill, they had an accident, whatever it might be, and they come to that experience with all kinds of anxiety.
Mm-hmm.
And all of a sudden they have issues related to difficulty making an appointment, checking in, the time that it takes, understanding the cost of the service before all the things I just talked about.
Mm-hmm.
And the point I make is that yes, it is a needs service for many patients who seek emergency care, but that amplifies the importance of the hospitality elements in delivering the care,
Yeah.
because the hospitality elements help manage down some of that anxiety. I mean, we've
True.
all sat in an emergency room way too long, right? And the anxiety is building. And I mean, something as simple as, and a lot of hospitals now do this, which publish the wait times in the emergency rooms. They
Mm-hmm.
say, okay, your wait time is 32 minutes. Well, at least you know that you're going to be there for half an hour. If nobody told you it was 32 minutes, you'd be sitting there 20, 25 and wondering what's going on. Anyway, you
Mm-hmm.
get the idea. So
Yep.
even though it is a need service, and we acknowledge that, we think that it actually underscores the importance of hospitable healthcare.
Yeah. Amazing. All right, Peter. What's the one thing that's going on in your life right now that you're really excited about? Either something you're working on to develop yourself or your people.
Well, be this book.
Mm-hmm.
It took us 2 years to write this, and as I said, we did a major piece of national research, and the reaction we've gotten to this book has been terrific from not just consumers, because we know consumers. If we say, well, wouldn't you like a more hospitable experience? Everybody says absolutely. But from healthcare practitioners, they say, okay, that sounds really good. Tell me how to do it. So in this book, what we've done is in our model, the PAER model, for each chapter, we've identified very specific action items, like how to prepare, how to anticipate, how to engage for healthcare providers. It's almost like a checklist.
Mm-hmm.
And it's amazing how healthcare providers react. Let me give you one example, and it happens to be addressing that number one deficit, which is not knowing the cost of the healthcare service before it's provided. I was sharing this with a CEO of a large healthcare system in New York a couple of weeks ago. And he said, okay, smart guy, well, tell me how we're supposed to address that. And I said, well, try this on for size. I said, when I book I'm not talking about non-emergency procedures now. Now, emergency procedures are unique, but non-emergency, and by the way, that represents a very substantial percentage of the procedures that any hospital system would do. So you have to schedule a surgery, whatever it might be. So I said, when I confirm my appointment, for that particular service or procedure, I don't know the cost, but why don't you give me a pro forma estimate of the cost of that when you confirm my appointment? It's the same that happens in most industries. So next week, if you take your car to a car repair service or for service, they're going to give you an estimate, and you have to approve that before they do the work. You want to book a hotel room or a vacation, you're going to know the cost of that before you take the trip. So why wouldn't the healthcare provider send me an estimate of the expected cost of annual physical, a surgical procedure, whatever it might be? And the reason I say that is the hospital and the healthcare provider knows the cost of the service before they confirm your appointment. Now, most patients don't know that, but they know the cost because all of those services are already contracted with these insurance companies. So they have a very specific dollar amount. They're going to get reimbursed for that, even though that dollar amount, as you know, is substantially less than what you see in the bill. But my point is that they could give you a pro forma estimate that says, okay, this is likely to be between $600 and $800. And they disclaim that by saying, we may discover when we do your examination that more tests are required, and therefore it's going to be a little more expensive. And we disclose that at the time the appointment is confirmed. But the point is that gives patients, then a general sense of what the cost might be, allows them to make an informed decision. about whether or not they want to pursue treatment there or someplace else. I'm sure, Unique, you've read all these stories about people that say, well, I looked at the cost of an MRI at hospital A and it was $2,500, and I look at an MRI at hospital B and it was $3,800. How can it be different? It's the same procedure. Well, the idea is that their margins are different, their reimbursement rates are different with insurance companies. They know that, you don't know that, but you could actually, as a provider, begin to minimize a lot of that anxiety by simply giving a pro forma estimate. So the CEO said, you know what? That's kind of an interesting idea. I said, you have all that information, but you just don't provide it.
Right.
So they're going to begin to explore the possibility of doing it. By the way, just this week, I saw Amazon Health. Amazon is now getting into the primary care business.
Mm-hmm.
And one of the things that they just released a press 2 days ago, press release on this, Amazon Health will give you the cost of the service at the time you book the appointment. And I thought to myself, wow, somebody's paying attention here.
Yeah, they saw the need of it. They did their work. They did their research.
Absolutely. Absolutely.
Yeah.
So anyway, there's an example of what I'm talking about.
Perfect. All right, Peter, we're almost at the end of our interview. Can you tell our listeners where they can find you online?
Sure. Best place is to go to hospitablehealthcare.com. Okay, the name of our book, title of our book. And again, some people say hospital healthcare. That's not correct. It's hospitable healthcare. The reason we selected that title is probably obvious, because most people don't put those two words together because they don't consider healthcare to be too hospitable.
True.
But we say hospitablehealthcare.com. It's got all the information on me, my co-author, the book, the content, how to order. It's on Amazon, Barnes & Noble, all the outlets. And I think anybody who is concerned about the customer experience or the patient experience in healthcare would really enjoy reading the book. Certainly the healthcare practitioners would enjoy and learn from that, but anybody who's been a patient would enjoy it as well.
All right, so we'll have the link to that in the show notes of this episode. Now, before we wrap our episodes up, we always like to ask our guests, do you have a quote or a saying that during times of adversity or challenge, you will tend to revert to this quote? If for any reason you get derailed or you get off track, the quote kind of helps to just get you back on track. Do you have one of those?
I'm not sure it's a quote, but it's more of a mantra, and that is tomorrow will be a better day. And that is, if, you get consumed by negativity, by certainly today, all the things going on in the world, it's easy to get very dark, very quickly. But, you have to awaken with the belief that things will get better, and generally they do.
Yeah.
And you as an individual have to be a major catalyst to that. You have to pursue it, and you have to be relentless. But yeah, if you ever lose hope in that, then you're probably headed to a very dark place. But that would be it. Tomorrow's always going to be a better day.
Tomorrow will be a better day. All right, perfect. Thank you so much for sharing. Now, Peter, we want to just extend our heartfelt gratitude to you for taking time out of your very busy schedule to share about your book, all the research that you did, giving us some real life practical examples that our listeners can take back. I think this book that you did is of great value, as you mentioned, not just to patients, but also to persons who are in the healthcare industry who are service providers. There's clearly a lot of opportunities from a hospitable perspective that healthcare providers could be doing that they're not doing. And I really hope that this book gets to more people and that they look on it, not like how the person that mentioned it's a need and not a want, but look on it that at the end of the day, in everything we're doing, there's always an opportunity to create that experience that people would want to come back to you, even if it's a need. Even if you don't necessarily want to go back and see a GP or your ophthalmologist or your dermatologist, you want to be cured. But at the end of the day, when you walked away from that experience, you'd be motivated to want to go back if something should happen to you, and not feel demotivated not to go back because the experience was not good. So I do think that what you shared with us here today will be of great value. Encourage all of the work that you're doing, and thank you so much again.
My pleasure. I enjoyed it very much.
Just want to remind our listeners that you can join our private Facebook group at Navigating the Customer Experience Community, and feel free to follow us on Twitter at NavigatingCX. Until next time, I'm your host, Yannick Grant.
Thanks for listening. For more awesome resources to take your customer service game to another level, head over to navigatingthecustomerexperience.com. See you next time.